Welcome to Sacramento County podcast series, County Conversations. I'm your host, Kim Nava. Today, we're here with Dr. Gregory Kann, Medical Director for the Sacramento County Emergency Medical Services, or EMS. Welcome, Dr. Kann, and thank you so much for being here.
It's great to be here this morning.
Wonderful. So can you start just by telling us about your agency and what your role is at EMS?
Sure. So I'm the medical director for Sacramento County for the EMS, Emergency Medical Services. So we are a organization which is tasked with providing the regulatory oversight for our emergency medical services, primary first responders for the community.
Okay.
So we have a mission of providing the folks who live in Sacramento County with world-class pre-hospital healthcare. And doing so in an efficient and effective manner, and to use those resources that we have in the best way possible.
Well, very good. Well, that's a great segue to some things I wanted to ask you about. First of all, so this month, EMS is launching the Triage to Alternate Destination, or TAD program. Can you talk about this program and how it will change the way emergency services handle behavioral and mental health cases that you see? And how will this change impact people's experience if they need emergency medical services?
Absolutely. This is a great question. So this is a program that we've been working for a long time to try to stand up here in Sac County. So Triage to Alternate Destination gives us the ability to take certain patients who don't need an emergency department directly to the type of care that they need.
Okay.
So through some legislative activity across the state, emergency medical services agencies up and down California have had an opportunity to stand up triage to alternate destination programs that deal specifically with people who are in psychiatric crisis or people who have a sobering need. So intoxication from alcohol or substances. And these folks generally don't need an emergency department. So historically, if you call 911 and you're suicidal, or if you're having a psychiatric crisis, you would be brought to an emergency department. And as a current emergency physician here in Sacramento County, I can say that wasn't always the best place for people.
Right.
Like, you can imagine somebody who's in crisis coming into a busy, active emergency department where there's traumas and heart attacks and strokes and everything else. That's not a calm and supportive and healing environment for those types of patients.
It doesn't offer the type of specialized care.
Exactly right.
Okay.
Exactly right. So as an emergency physician, I do what I think is best, and I work and I try to help these patients as best I can, but I am not a psychiatrist. I'm not somebody who's specialized in managing that type of a patient presentation. So by standing up Triage to Alternate Destination, what it allows us to do is for specially trained paramedics who are accredited for Triage to Alternate Destination through some additional training that we provide here in the county, to be able to assess a patient in the field, understand what their needs are, ensure that they're stable and they don't have another medical need that they would need to see me for. And if they're stable, they can take them directly to one of our psychiatric urgent cares, where they can be evaluated by a psychiatric professional and get the care they need at the time they need it. So we also know that folks that come to our emergency departments for psychiatric care in particular, they spend an inordinate amount of time in the emergency department. Mm. So somebody comes in who just needs to speak to a therapist, maybe have some medications adjusted, they can spend hours to days in an emergency department. And that gets back to my earlier statement that this is not a supportive environment for them.
Right.
You can imagine you or I wouldn't want to sit in a hospital bed in the ED for days on end. Right. So by being able to get them to the care that is appropriate at that time, they can get the care that they need and start healing faster.
So this is something that is good for all patients, for the patients that get the specialized care that can go to a center that can address their needs, and also folks who are coming into the emergency department, they can be seen sooner because other folks are steered.
Absolutely. Absolutely. This has a ripple effect all the way through our healthcare system. So in historically, those bed spaces would be taken up with patients in psychiatric crisis. If those beds are available, now all of a sudden we have a place to offload ambulance patients that are coming in. So I know we're going to speak about ambulance patient offload times, which is near and dear to my heart.
Yes.
And also if you're coming in the front door of the ED. So if you have chest pain, or if you have stroke symptoms, or if you think you have an infection or some other emergency situation, you're going to get a bed that much quicker if those bed spaces are available. And then the people, again, going back to the people that are there for a psychiatric crisis, they're going to be getting the care that they need, not in the emergency department, which is better for them ultimately.
Right. Well, thank you for saying something about APOT, because you've been really on the forefront of that. So first of all, I want to mention what APOT stands for. It's Ambulance Patient Offload Times. And so can you give a brief description of what APOT means, and then describe how the county is leading the way in reducing these times?
Yeah, so we're very proud about this, particularly. So ambulance patient offload times is, so you can imagine a patient calls 911, they're brought to an emergency department in an ambulance, and they're on an ambulance gurney, and they're brought into the emergency department. They're registered, and the time from them arriving at the emergency department to the time where that patient is physically removed from the ambulance gurney and put onto an emergency department bed, and care is transferred over to emergency department staff. That is the time that is ambulance patient offload time. We have targets in California and specifically in Sacramento. Now we're running on a 30-minute target for that transfer of care to occur. But traditionally or historically, Sacramento has not been very good at this. And we've had some very, very long ambulance patient offload times where patients would arrive in the emergency department. They wouldn't be transferred over to emergency department care, and they would sit on the ambulance gurney in a hallway just waiting for that care to take place. So you can imagine that the patient that has an emergency medical condition like chest pain, or maybe they're having a stroke, or maybe they've got a serious infection, they're sitting on an ambulance gurney just waiting, and they're not having that issue addressed. Right. So there's a patient care question there. Are we delaying patients getting the care that they need when they're sitting on a wall in an ambulance patient offload delay situation? Mm-hmm. So we tackled this program essentially day one when I came on board at Sac County EMS back in 2003 or 23. And because we recognized that this was an incredible, I think, hurdle or opportunity for Sacramento to try to get better.
Right.
So through a whole host of innovations and opportunities to engage with different stakeholder groups, we've been able to go from really the worst in the state to one of the best in the state.
Absolutely.
We have right now 6 of our local hospitals are compliant with the state statute for ambulance patient offload times, and the ones that aren't compliant are within shooting distance of getting compliant, very close.
So there was a lot of work you had to do with our local hospital systems, mm-hmm. right, to get to this one. I think I read somewhere that before the average was maybe over an hour, and now we've really come down thanks to your efforts and working in partnership with our hospitals.
Yeah, and this is a team effort. You know, I think I sit at the forefront of the Sac County EMS agency, so I tend to have a lot of conversations, and people thank me for this work, but this is not just me. You know, this is a team effort. This is all of the emergency department staff at all of our local hospitals. This is all of our EMS providers looking for innovations and how they can get patients off the gurney quicker. I think when we shone a light on this issue, we were able to really highlight kind of areas of opportunity, highlight areas where we were missing the mark, and to do some innovative things. I point to some of our local hospitals that have dedicated ambulance patient offload areas where they have dedicated staff to that endeavor. These are some really low-hanging fruit interventions that have paid off in incredible ways and are being looked at by our peer agencies up and down the state.
Well, Sacramento County certainly has received recognition as a leader in these kinds of improvements. And so just overall, what would you say we're doing differently from other counties, and how are we setting the standard for emergency medical services in the state?
Sure. I think that we've done a really good job of bringing everybody that is involved in emergency care. So that's not only our pre-hospital providers, but our emergency departments and our hospital administrators and the folks that deal with patients when you're admitted to the hospital and bringing everybody together with an understanding that we're all part of the same healthcare team. And that if any one kind of phase of patient care is not where it should be, everybody suffers. And that's not good for the patient. It's not good for the overall health and safety of the folks who live in the capital region. And I think everybody's bought into this idea that we are all part of the same team. And I think that what we've done at that Sac County EMS agency is really fostered an era of collaboration, which I think is different than what we've seen up and down the state. We've brought in some other different collaborators from some of our, like from Sacramento State and other subject matter experts in kind of process efficiency, which has allowed us to really open the doors to some new out-of-the-box thinking about who touches the ambulance patient offload time question, and to bring those stakeholders in. And that's kind of the future of where we're going, is we're looking at not only the patient arriving in the emergency department and what we can do to innovate in that space, but we're also looking at when a patient's in the hospital and how they get home. How do we clear the bottlenecks for discharge from somebody who's in the hospital to going to a skilled nursing facility or some post-acute care place? How do we make it so that those pathways are smoother? The patient that's going home, how do we make sure that they can get the equipment that they need to go home safely and to thrive while they're at home? These are all pieces of the puzzle that I don't think have ever been looked at, and I'm proud that we're doing it in Sacramento County, and I'm hopeful that we can be really a model for everybody, not only in California, but across the country.
Well, thank you very much, Dr. Kann, for that, for the improvements you've made, for what you're continuing to do for emergency medical services in Sacramento County. This is something that touches every resident. And so very appreciative of what you've done, been a leader in the state, and we look forward to more and hearing about everything else that you're doing. So thank you again for coming in today and sharing your knowledge and your perspective with our listeners. To our audience, thank you so much for joining us. We hope you enjoyed this podcast, and we hope you'll listen again as we feature different county department leaders throughout our series, County Conversations.
This podcast is produced by Sacramento County with production services provided by SacGov Studios.